I have been having the most fascinating conversation with Dr. Darren Scott from Chronic Care. This is like mind-blowing to me. So many people are working out, trying to lose weight, and no matter what, they just can't quite lose the weight. I know tons of people who are struggling with this. And you have, with all of your years of experience, have come together with the best combination to figure out what the problem is. First of all, welcome.
Yeah, good to be back.
And tell us what you guys do at Chronic Care.
Yeah, so, we have patients that have fatigue, they're tired, and they can't, lose the weight. They've dieted, they've exercised, and they're like, well, why isn't it coming off? And many times what we're talking about today is it could be your DNA.
Yeah.
We talk about the biggest thing you have to figure out, regardless of the condition, whether it's thyroid or weight loss, those are just symptoms. You have to find the underlying reason of why that thyroid isn't functioning properly, right? And so the DNA is one of those issues.
Yeah.
Right? Yeah.
Which is so fascinating to me because you hear so much about thyroid, so many people having thyroid issues, and then when you pull in the combination of the DNA, like that just makes sense to me. And what you were saying during the break, which was so fascinating, is you can be taking, supporting the thyroid, doing all these things, and it's like, why am I still having symptoms? And it's because you haven't addressed this gene.
Correct. The gene is a big, and when we're talking about genes, what we're looking for is, like, in particular, there's multiple defective genes that you can have. The big one, is the MTHFR gene mutation.
Okay.
It makes it so things don't work properly. And the two types of patients we normally see is they've been diagnosed with something.
Right.
They're taking medication and they still have symptoms.
Yeah.
The other one is they went and got their blood checked and they're told that they're normal and they still have symptoms. And we see patients actually all over the country now, and they're missing pieces of the puzzle, and the DNA is for sure one of the big missing piece that really no one's really looking at, but the researchers are saying it's such a dramatic effect on whether your thyroid works, or if you have a chronic condition, or if you want to lose weight. That's a big factor because it can make it so you can't lose weight.
Look how amazing these before and after pictures are. So these are some of your clients that have obviously seen amazing results. Wow. I mean, it's clear. In my mind, it's like that makes sense, right? Like,
yeah.
Everything has to be functioning, properly to get the weight off.
Yeah, and what's interesting is with these patients is, like, almost all of our patients will lose weight, and weight's important, but the biggest thing that we see is our patients usually come see us because they want to feel like them again.
Yeah.
They just don't feel themselves, and they're looking to get their life back. And when you address all of the underlying issues, depression, anxiety, all these things, the patient feels like, I have some patients, they feel like themselves for the first time in decades. And they're like, I just can't believe this is changing. I've tried so many different things. It's again, it all goes down to finding the why.
Yeah.
And in this particular case, DNA is we pull a lot of DNA testing on a lot of our patients because they've done a million other things, but that could be that one missing link.
Oh my gosh, if you guys are looking for answers, which I know so many people are, you need to go see Dr. Darren Scott at Chronic Care, and you're actually offering a great deal right now. The first 20 callers that call his office get a consultation for $49, which is amazing. So there's all the info on the screen right there. You can also go to ccofutah.com for more information to find out everything else that you guys do over at your at Chronic Care. And Dr. Darren Scott, thank you.
Thanks.
I'm making an appointment. I'm going to be seeing you soon because this stuff is so fascinating to me, and I think it makes sense, right?
Great, yeah.
I love it.
Yeah.
Good stuff. Thank you so much for being here.
Thanks.
Appreciate it. All right, you guys, we'll be right back.
Flooring for Good Things Utah, provided by